All righty, we're in the home stretch here. Cocktails and hors d'oeuvres are less than an hour. Yep. And we have a prize, a nice, let's see, iPad that someone left behind. Going once. Darn, I thought it was a door prize. Thank you so much. You're so welcome. Everything that, all of the talks that you've seen here today, other than the breakout sessions, are being recorded. There's a live webcast. In addition to that, we will have everything archived on the Wilson Center site and most likely on our Disease Initiative site as well. So in case you're like me and there were some of these things that you heard and saw and they went by too fast and they just tasted like more, don't worry. You can go home and you can watch some more. So finally, to finish up our absolutely wonderful day of fabulous presenters, we have Madeline Thompson, and she's a senior research scientist at the International Research Institute for Climate and Society, and she's a senior scholar at the Mailman School of Public Health in Columbia University. So without further ado,
well, thank you very much, and thank you ever so much for the invitation to come and be with you here today and to have a presentation at the end of the day. I do know that it is a slot that is between you and the drinks session, so I shall try and keep it on time. Part of doing that, I will actually want to start with a major acknowledgement. I think we had Lawrence Friedel and John Haynes in particular at the beginning of the session. And the reason that I would like to acknowledge John Haynes in particular is that I started working with NASA maybe 30 years ago when Louisa Beck was involved with the CHART program and Byron Woods, and they were a fantastic team. But they would have agreed that the work that they did had very little public health impact. And the challenges that they faced in terms of promoting Landsat information, ArcGIS, etc., was sort of fairly unsurmountable for public engagement at the level of working with health authorities, etc. And I think John in particular has done a huge amount of outreach and has been very aware that you need to go where the health community is and not expect the health community to come to you. And so I wanted to make that acknowledgement at the beginning because we never know, we may run out of time. I also wanted to then add to my title list, if you like, is that, which I think is most relevant to this session, is that I direct a WHO collaborating centre, and WHO has about 800 collaborating centres around the world, and quite a number of them are in the US. I have number 430 for the US, the rest are elsewhere. And the title of the collaborating centre that I direct is Malaria Early Warning Systems and Other Climate-Sensitive Diseases. And what this means, we've had the collaborating centre at IRI since 2004. We engage with Geneva, HQ, with AFRO, with PAHO, etc., looking to see if some of the work that they're engaged in would benefit from climate or environmental information. And we'll learn a little bit about that as we go along. Now, those of you who are not aware of the institute that I work for, it's the International Research Institute for Climate and Society. It was initially funded by NOAA about 20 years ago. I was invited in 2002 to lead the health work, and we structure our health work. It's a mission-driven institute, if you like, within Columbia University. So we're all Columbia faculty, but we judge our work by different criteria, and the type of most important criteria that we judge it by is impact. Are we getting our research out there? Is it changing the way people do business, the way people think? And it has a very strong public mission in the developing world in particular, and a lot of my work is focused on Africa. Anyhow, within the health group, we organize our thinking around what I call an ideas framework. Innovation, research activities on the one hand, involves developing models, etc., demonstration, in-country activity with national partners, seeing whether the stuff that we're doing makes any sense in terms of their decision-making processes. Education, we have a curricula that's been developed over quite a number of years for how to engage the public health community in climate and environmental information. And as of in fact, yesterday, I think, we submitted our final grades for a new master's module at the Mailman School of Public Health called Climate Information for Public Health Action, which involved, again, students from different departments learning about the use of climate and environmental information in decision-making processes. And we also work as an advocacy. I keep correcting that slide, but I obviously keep picking the wrong slide from previous presentations. So advocacy, which is where we look to try and engage with different institutions to help them think of climate and environment as a resource for decision-making today, not just a long-term theoretical activity, like what are we going to do about climate change, but how to engage people in understanding the climate and the weather of today and how that is changing over time. We also provide a major service, which is the IRI Data Library. I don't know if any of you are familiar with it, but it is the largest public portal of climate and environmental data that's available globally, and we serve, if you like, information to a very wide community. And the way that we do that is to take information from lots of different sources, including NASA's data sources, and allow the users to take the information out in lots of different formats so that they can have the information to go into their own system in a useful way, or they can do analysis within the system. I wanted to talk a little bit about I trained as a field entomologist, right? So I have landed up in a rather weird space talking to climate people all the time, which I find rather odd. But it has been, a sort of fascinating process. And one of the things that I think is important to understand is really how do we measure the climate? We measure it from the observing systems, which go back. There's been observing systems run in the UK since the mid 1850s and what have you that are still running today. We have satellite observations, which obviously have absolutely changed the way we look at the world. They're really recent. They go back 40 years. Yeah. And then we have reanalysis data where we model the climate, and we can do that in going back into the 1950s and what have you. And these are the way we look at the climate and try and engage climate information in public health decision making. So if we want to think about early warning systems for malaria, that's definitely not a new business. Yeah, a century ago, people were using climate-based early warning systems for malaria in the Punjab. Yeah, and it was established as a result of a catastrophic epidemic which happened in 1908. And was followed by various analyses, and they concluded that that was the result of an unusually wet monsoon season, prevailing economic conditions, which meant that economic conditions were really rough and the vulnerability of the population was high, and there hadn't been an epidemic for at least 5 years. So they started using that as an early warning system, and that sort of ran all the way through the colonial period until India's independence. And fundamentally, what shamefully was the reason why they didn't need it after independence is that once there was independence, the Indian government sorted out food distribution properly in India, and you didn't get the level of vulnerability in the population that occurred under the colonial administration. We have a big dearth in the use of environmental and climate information through the 50s, 60s, 70s, and what have you. We had the global malaria eradication campaign using DDT, which was like a mass campaign, spray everything, treat everything, and that was incredibly effective. Malaria went down enormously across the Indian subcontinent, in Latin America, around the world, and in the US, of course. And nobody was really interested in the details of environmental drivers until the whole system collapsed in the 1970s with resistance to chloroquine and DDT. And it re-emerged, if you like, with GIS in the 1980s, when we started to have a different way of looking at the world. The medical geography, if you like, had disappeared under the old system and was reborn as departments of spatial statistics or spatial analysis or GIS-type activities. Anyway, in Africa, where I've done most of my work, we started having big epidemics of malaria in the 1980s. But this one was at a time when I was very much involved with the WHO technical group on predicting epidemics, and it was the image from the 97-98 El Nino, where we had a huge dump of rain in the second decade of October in 1997. And that's what it looked like when it was the rainfall estimates were analysed, and you could see this huge dump of rainfall over northern Kenya, northeastern Kenya, and which is normally a very dry area. Yeah, and what actually happened there is that in the northeast, it's an arid region. The people nomadic population. They don't actually have malaria normally there at all. All the malaria cases are imported, and suddenly they had massive flooding in the region, a huge amount of rainfall, which precipitated that, and catastrophic malaria epidemic. And when we say catastrophic in public health terms, catastrophic means, I think it's 10 deaths per 10,000 per day. Yeah, and that was over a very short period. We had 10,000 deaths in that region. There was also Rift Valley fever epidemics going on, cholera, etc. And you could see this incredible relationship. Huge amount of rain, huge amount of cases. But it's not just the rainfall that was a problem. We had, at the same time, was a nurses' strike. They couldn't get there because of the roads were all flooded. There wasn't any distribution. And there was a big focus, actually, on the time on Rift Valley fever because they were very concerned about that. So the malaria department itself in Kenya, which I visited shortly after this, was a very weak department in the Ministry of Health. Malaria actually was generally weak as an institutional context at that time. So that was the late 1990s. From 1996 onwards, epidemic malaria started to emerge in the global policy environment through what was then called the Global Malaria Action Plan. And there was a technical committee that was established by WHO, which I was involved in, and we came up with an early warning system, which is guidelines, like how to start thinking about an early warning system, which has, you should read it actually, it's surprising how relevant it is even now, which is sort of amazing, because we included seasonal climate forecasts in that, and I, at the time, had very little understanding of what they were, what they did. There was no evidence of use of them whatsoever, but they just sounded useful. So there was a whole environment, if you like, which allowed you to think about using climate and environmental information in early warning systems for the first time, really, in the African context. And one of the things which I think is so important to understand in terms of early warning systems for health is that we don't need climate forecasts to create health forecasts. We need observed information on the environment and the climate, which allow us to give forecasts of health outcomes. And the beauty of that is basically just all the lags that connect the environment to the health outcome. So you're never going to have a huge deluge today and a malaria case tomorrow. There's always going to be a lag of 1, 2, 3 months before that happens, and that gives the community a chance to intervene. So back in, this is 2001, we were all quite excited about our new technical working group and the ideas that we'd put together, etc. And we were using something called WinDisp to do our analysis, which I don't know if any of you remember, but it was a tool that FAO put together to look at rainfall estimates. And I was working also in West Africa quite a lot at the time, and they were looking to create an early warning system for the whole of the Sahel. So we observed that there was unusually heavy rainfall in the Sahel, in Niger, and as part of the discussion with WHO, we sent them an image. And before we knew it, they had sent that image to the WHO office in Niger, which sent it to the Ministry of Health, which then used that image to go and target and sent an entire team down to southern Niger, where that big green blob is, and there wasn't any malaria. So that actually killed environmental monitoring for malaria in Niger for about 5 years. And it really made me acutely aware that if you are coming in from the outside and you are going to provide information, you really have to understand their system and you have to have evidence of utility. And so we've improved a lot since then. And they have come back on board very much in the terms of the need for environmental information. But you do need to know when and where you should use it. The first thing is, like, what was the evidence of the relationship of climate to malaria in Niger? They had no proper malaria data. There was this one study that we had from Maradi, which you can see. This is variations in rainfall at the bottom, and you can sort of see there's a rough match with malaria on an annual timescale. And actually, every time we've looked at data that was bad and saw a good relationship or some relationship, as the data has improved, that relationship has also improved. So it was a signal that there is something there, and you would expect it to be there. But again, you need to figure out how are you going to translate this into a decision-making process that the Ministry of Health can use. And if the forecast is not correct, they are able to insulate themselves, if you like, from the negative press that they will get. So you need to think about that a lot in terms of using early warning systems. A number of you may be familiar with the work that was being done in the Kenyan highlands at Kericho. At least 15 years of argy-bargy between those saying that the increase in malaria in the Kenyan highlands, and in fact the East African highlands at the time, was a result of drug resistance. Others saying no, this is a result of climate change. As is usual in these things, it's probably a bit of both. But definitely another challenge in terms of how do you model, because it's not just rainfall here. You've got to think about rainfall and temperature. And you need to start thinking about much more complicated models. So one of the activities, and actually one of the great things about working at the IRI, is that we work with the national Met services in many of these countries. So we are able to work with them and access and clean the data from the Met stations that are most important and most relevant. And what might surprise a lot of people is that 15 years of argy-bargy around whether or not it was climate driving malaria in the East African highlands, no climate scientists were actually engaged in any of those studies. And the first climate analysis for Eastern Africa was in 2008, on temperature. And my colleague Brad Lyon did a very detailed analysis with the Kericho data. And what was, I think, astonishing to me was that this graph here shows minimum temperature, which is the green line, which is the tallest line in the middle there. You can see it stands out when there's the 97, 98 El Nino. And then this brown and yellow lines are actually the temperature around the equator in the sea and the temperature around the equator on land. And you're looking at the green line is from one little Stevenson screen temperature, minimum temperature thermometer in the T states in the Kericho Highlands. And there's this incredible relationship of local to global. The correlation is phenomenal if you know how to organize the data and present the data. And to me, this was absolutely striking that actually locally we can see climate change. We can see it because there are definitely trends in the climate. We can see the big El Nino. We can actually see other El Nino periods there as well. And we can see this hiatus. It stopped warming for about 15 years. You can see it in the data, yeah? And you can see it in the local data as well as the global data. And of course, now it's all warming again since about 2014. I'm going slightly out of chronological order here. Up till now, we've been sort of like following a sort of personal track. But one of the things that really stands out is the impact of ENSO. Yeah, we have these really unusually warm years when you have an El Nino, or cooler years when we have a La Nina. We also have, in some parts of the world, wetter conditions, and some others, drier conditions. And this effectively provides the basis for early warning systems using forecasts. We at the IRI deliver a lot of our information to other technical experts and to the public through something called map rooms. They're online, publicly available. And this is an analysis of CHIRP's rainfall data. So this is satellite data with some observed data included. And then we just compare it with sea surface temperature data, which is what we use to make estimates of El Nino. And what we can see is that in October to December, I don't know if you can see the red area over towards Eastern Africa, we get a really strong relationship between rainfall and sea surface temperature associated with El Nino. the July-September, which is the main rainy season for the Sahel, we get maybe a little bit of an effect, but we get one hell of a wallop in Ethiopia. And that's very consistent. When there's an El Nino, we get drought in the July to September season in Ethiopia. And then March to May is the main rainy season, actually, for the East African region, and there's no effect at all. So you have to know quite a lot about when and where to be able to understand when you can use these climate drivers. And in particular, Southern Africa also, when we have an El Nino, instead of it being wet, it's actually dry. You're able to go online, look at these tools, click on them, and you can actually see the relationship. The blue bars are when there's a La Nina, and the red bars are when there's an El Nino. And this is the rainfall averaged over Zimbabwe, and you can see Zimbabwe has a real problem when there's an El Nino, there's drought, but when there's a La Nina, there could be a lot of excessive rainfall. The truth is, though, is that these things are uncertain. We had some great discussions around uncertainty, and even with 40 years of rainfall estimate data, or nearly, it's not really long enough to do statistically valid estimates of the impact of ENSO. So we like to present the information like this without any stats, but just so that you can say, oh yeah, there looks like there's an impact here, or oh yeah, there's an impact, but it doesn't always happen in the way that you might expect. This is Botswana. We can look at again here. The red is La Nina, which is blue is La Nina, sorry, and red is El Nino. And this is malaria cases now, detrended malaria cases. You can see the up and down of malaria around the normal trend is very strongly impacted by ENSO in Southern Africa, and that forms the basis of seasonal forecasting. ENSO is the biggest global contributor, if you like, to seasonal forecasts, particularly for Southern Africa. And we've shown quite clearly that you can make climate forecast for Southern Africa 2 months ahead, effectively, of what you'll see in the rainfall data, in the satellite-based rainfall data, and that this then provides a very good indication of whether you'll have unusually high or low malaria. This is an interesting challenge for me, and people don't normally advertise the papers that were rejected, but this is a paper we wrote at, I think it was 2005, sent it to WHO Bulletin, saying, look, with the MDGs, a lot of those MDGs are climate sensitive. You're going to need to measure the climate in order to not have the climate somehow undermine or overestimate your results. And we actually got quite rude reviews, and people said, no, that's not at all important. There's loads of other things that drive malaria. Why would that be important, et cetera, et cetera. And it was interesting, actually, with the MDGs, climate was not really factored in at all. Actually, the only thing was in the hunger task force. So I shall come back to that in a little while. But one of the biggest challenges that we have, and this includes with all of the climate data, whether it's the satellite data, whether it's the observations, of course, and whether it's the forecast information with models, and that is the problem with the observing system. The observing system has been in decline for the last 40 years or so, and large parts of the world have very intermittent information available from the ground. And all of our climate-based information requires that validation, calibration from actually what happens on the ground. And so what we have is a massive improvement in global information, particularly contributed by NASA, but by others as well. But some of those products, a real decline in the quality because they don't access enough of the observations that are available from the ground. And this is what we see with the CHIRPS data. Going back to the 1980s, they had maybe 2,300 observations coming in every month from Africa. Now it's just over 500. We can see why this is happening, because if you go to the countries themselves, this is Madagascar. The Madagascar Met Services were running about 400 stations back in the 70s. They're now running about 30. Yeah? We can see other reasons. Rwanda, a little country with actually quite a lot of stations, nearly 100 stations. All of those stations disappeared for about 15 years following the genocide. These data gaps are incredibly important to the quality of the global products. We also have lots of quality control issues. This is where somebody's mixed up Fahrenheit with centigrade, and obviously that will get smudged into the data because it's still there, it just gets incorporated. The quality control is a big issue. So one of the projects that I've been involved with over the last 10 years now, really, is something called ENACT, Enhancing National Climate Services. And the rationale here is that we have fabulous global products which are great, as I think Lawrence Friedel made really clear this morning. They're great global products, and you can make decisions in Washington, you can make decisions in London, etc. They're not always appropriate for making local decisions, and particularly when it comes to rainfall and temperature. So what can we do? We've seen the decline in the observed data coming in to the global products. But what we have, actually in many countries, is a lot of data that doesn't get into the global products that they still have, that are held by the national Met services. So here, if you like, we've created a blend of the best of the global products and identified the local products, the local Met station data, to create a blend between the two. And now this is happening in about 10 countries in Africa, with support from, as you'll see at the end, from a wide range of funders and contributors, including very much NASA. So the difference then is, like, what's the advantage? On the left-hand side, you have the data that Ethiopia gives every day to the Global Watch through its global telecommunication system. Yeah? In the center, you have the data that the Ethiopian Met services receive every day for their own purposes. And then on the right-hand side, you have the historical data that doesn't necessarily come in daily, but by the end of the month or the end of a certain time period, it'll come in, get cleaned up, go into the archives. And so with the ENACT data is working with the data in the middle and on the right-hand side. We can make better monitoring products in country, and we can make considerably better historical products by working with them. This is how it works. You've got the station data. On the top right, you've got gridded stations, and then you always get odd things happening with gridded station data, with borders that you don't know where the edge of what phenomena you're looking at. Then we've got the rainfall estimates, which give you a really good idea of the spatial structure of the rainfall, but not a good idea of the intensity necessarily. And you make a blend of the two, and there you are. That's the new product. And the same thing happens with with temperature. This time we use reanalysis data from MIRA or JRA and elevation, etc. And now on the websites of the National Met Services, I have to say this with Ethiopia, not on their website at the moment because the website's down. They're moving building, so you won't see it there. But on the other 10 countries, usually 6 of them are up and running. You can do all sorts of analysis and actually look at what's happened in the climate there. And you can explore in lots of different ways the seasonality, the interannual variability, including the predictability and the relationship to ENSO. And with this, you can now start thinking about how the public health community might engage, because the data can be organized in a way that links directly to their decision-making processes. And here in Tanzania, what you see very clearly, the benefit of the local data. So on the left, we have CMAP, satellite-based, with a bit of station data. On the right, we have the ENACT product, which is satellite, but with all the Tanzanian data. And you see a big jump in the definition, if you like, of what's been going on with the climate. And this is particularly important for health decision-making, because when they evaluate the malaria program, they should know whether it was a wet year, their baseline, or a dry year, because it has huge implications. For Tanzania, they were using B as the baseline, which was 95 to 99 with the big El Nino and lots of epidemics. And then A is their intervention period, which had 3 mega droughts, and etc. So you can imagine malaria is going to go down anyhow. It didn't matter what they did. They were onto a winner. It sort of feels nice to be able to just, do that and go to the minister and say, we had a great success, malaria's, gone down. But it's sort of thing that will come back to bite you, because the rains will come back. And when they come back, then you've lost your job. So we have encouraged and I think got a lot of traction actually with the ministries of health and with their donors about the importance of measuring the climate to make better assessments of impact and intervention. And then going back to that rejection by the WHO bulletin, this now, rainfall estimates, included in the President Malaria Initiative's special issue on how to look at malaria interventions, and which they did late last year. And it was, to me, it was particularly thrilling that they had to have a paper which just talked about rainfall and temperature in all of the countries where they were doing their malaria work. So we have similar issues in Ethiopia. This is how people used to look at the impact of El Nino, where you'd have droughts in the north. Now we can look at that in a lot more detail. On the left, this is what happens in the July to September season, where rainfall goes down. In the centre, this is what happens in the October to November season, when rainfall goes up in the south. And then we have warming across the highlands. And so when people say malaria in Ethiopia, it is a complicated business, as Michael will testify. And it really depends on which part of the country you're in. And you need to have information for the Ministry of Health that clearly demarcates out. You can do this in this area, but it's not going to work there. You can do this here, but it's not going to work there. One of the things we see all across Eastern Africa, and particularly here in Ethiopia, are these warming trends. Warming trends with El Nino bumps. Therefore, in Ethiopia, it's particularly important because they have their national policy is dependent on temperature. They have set 2,000 meters as guidelines for above, no malaria control, below, malaria control, on the assumption that that actually is a realistic assessment of where you should get transmission. But if you look at the stations from around that area, we can see, depending on which side of the mountain you're on, huge differences in threshold temperatures for malaria transmission to the, sort of like 10 degrees if you, for stations that are at the same altitude. This allows us, because we have national data at high resolution that goes back 35 years now for Ethiopia, you can start creating analysis which looks at where is the altitude, how does the altitude relate to the temperature, where is it warming, which populations are now more exposed than they were previously, even if you take out the impact of ENSO. And this is an analysis that we published last year. So the ENACTS initiative is allowed us to engage in all of the countries with national partners. And I think one of the things, we had, a lot of fantastic discussions today, but the partnerships were not so much like, how do you really engage with the national partners? And the key challenge here is national products, yeah? Because they have to own the products to use them. They have to see, because they're the long term, they're there for the next, they're there for the long term, their lives are there, their careers are there, their kids are getting sick. We engage, we hopefully do something helpful, but it has to be this ownership issue has to be dealt with. So I'm briefly going to say something about forecasting in terms of, because I come from the IRI and we're a forecasting institute, so I have to say something. But what it means here is this whole thing about what's the skill of forecasts. Yeah? If you've got the observations, which will forecast disease, but now we want to use forecasts, weather forecasts, seasonal forecasts, climate change predictions. What value are they? And we all know weather forecasts generally are good, but after a few days they drop off and they're pretty useless. So you don't make plans for a picnic on a forecast in 10 days' time. Well, if you do, just because it's on your app, then it's a bit silly because it doesn't really work. But we also have some pretty good information at the seasonal timescales for some places in some seasons. Yeah? And we have a very strong sense of the trajectory on climate change with warming. But these all work at different spatial scales and at different temporal scales. And we have to understand those. And we have some very sad gaps. The subseasonal, which John Bulbus mentioned, is really a new experimental area. We don't expect it to be as good as either the seasonal or the weather scale. But maybe we'll get something out of that. Decadal prediction is a huge challenge. We don't have any good decadal prediction, really, that's in any way relevant at an operational timescale. And this means that we know it's going to be warmer over the long term, but we don't know if 2025 is going to be warmer or cooler than 2027. We just don't know that. Yeah? And that creates all sorts of problems. And we know much less for rainfall. So, when it comes to vector-borne diseases, by and large, weather forecasts are not much use because the actual observations which you get from satellites or observed systems can give us, we see something happening, that will tell us what's going to happen in 3 months' time. So a weather forecast that adds 3 days to that needs to be used for something we need to be acting on in the 3-day time frame. Seasonal forecast, yes, especially where there's a strong ENSO connection. But it's pretty vague information, large scale, doesn't always work, and fairly uncertain. And then we can see the value here, actually, of why better observations and better rainfall products, which blend satellite data and stations, are really important for seasonal forecasts. So this is a study from Rwanda. And in Rwanda, they have the ENACT system. And here they were testing out how predictable the climate is, using a seasonal forecast prediction system. And on the left-hand side, they have ARC2, which is a sort of old-style rainfall estimate that we have. And wherever it's green and above, there's some evidence of predictability. So with ARC2, they couldn't find any predictability. On the right-hand side, we have a new satellite estimate, global product, based on chirps. And you can see now, yes, you can start to predict chirps data, which means that chirps represents rainfall much better than ARC2 does, at least for Rwanda. But when they put their own data together and they use chirps as a basis and then add in all of the Rwandan data, they get a much stronger result. So now they can really realistically think about using seasonal forecasts in Rwanda, where they couldn't really think about doing that before. So the observations, again, are really, really important. Climate change, we've done some work with WHO on this for the global eradication strategy. And again, we have this pretty good sense of what's going to happen over the long term for temperature, a very poor sense about what's going to happen over the medium term and the long term for rainfall. So what can we do with climate information? I think the focus on early warning systems is sort of sexy. It's politically engaging. You have a big trauma and you say, let's make an early warning systems, but early warning systems are a bit complicated. And I think there's a lot more you can do with the data than just develop an early warning systems. Understand your populations at risk, do planning processes, look at the seasonality, a really important part of planning cycles. Then the top one, actually, I missed out. Just understand the disease models better of all. And then you've got your early warning systems, monitoring and predicting variations, etc. And then we've got longer term trends. But the final one, this use of climate information in impact assessment, to me is the one that has engaged the policymakers most of all. And the reason for that is that it affects their budgets. They are concerned when they go to Congress or go back to the Ministry of Finance or go back to their donor, that if they don't present the information correctly about what they're doing, then their funding will be cut. And that's proved really important now because there is an uptick in malaria all over Africa the last few years. And the big question is being asked again, is that the climate or is it drug resistance? We've actually gone back 20 years to say that, and at least now we have the tools to answer that and we can do something about it. So last few minutes on integrating research into decision making. I think we always have to think, if we do research, that if we want it to enter decision-making processes, we need to think about those processes from the get-go. And the sort of way I think it's useful to think about it is like, what's the organizational perspective that you're trying to enter this information into? What do your stakeholders and policymakers actually think? And what capacity is there at the level that should use the information to actually use it at all? Yeah. So here's a great graph, I think, of the supply system for medicines in Tanzania, right? So when you say, oh, we'll give them a seasonal forecast, and then you look at that and you think, oh, yeah, okay, well, you've got X number of different donors being involved, different financing mechanisms, a whole range of different diseases, and then all of this stacked processes, eventually this all, in theory, at least lands up serving the public at the end, yeah? So if you don't understand that system, yeah, what chance have you got of influencing the way funds are moved? Because at the end of the day, a forecast should change are we going to put the money here or are we going to put the money there? Are we going to move commodities up to the front line this month or are we going to move them up to the front line next month? So they have to change something in this pattern. Yeah? So we need to learn about how the supply chains work, etc. We also need to understand, of course, the policy and stakeholder perspective. And the meeting that we had with the Rollback Malaria Partnership in 2014 really, the light bulbs went off when we talked about the impact assessments. And because that was their big concern. Are our budgets going to be taken away if we're seen to be failing? Yeah? So that was something that we knew we needed to support them in. And of course, with other diseases, with Zika, in nutrition and other areas, we've got to really understand what is their priority, to have an effect. And then the practitioner experience for us, and for me personally, I think it's the most exciting thing, is really engaging with practitioners and seeing how their skills can be built and supported, the skills that they need in epidemiology, in health surveillance anyhow, and how by adding a bit of climate in there, we can actually enrich that and give them more information. So this is the final slide, and you're seeing a number of sort of new graphs for me because we're publishing a book, this is my plug, on climate information for public health action, which should come out in October. And for me, this expresses a lot of the thinking that we have. We have a problem focus. We've got to identify what the problem is, yeah? And then we have, everything is a model at the end of the day, whether it's a super complicated one or a fairly simple model, but we need to model the relationship between environmental drivers and outputs that we're concerned with. And there is uncertainty, as we had the great panel earlier on about what those sources of uncertainty, and a big source of uncertainty are the boundary conditions. This is the climate data. Like how well does whatever it is we're looking at a MODIS land surface temperature grid, how well does that actually represent temperature experienced by whatever it is you care about? We also have the whole thing about initial conditions. I mean, you can't have an epidemic if you don't have any infection to start with. So if you don't have the initial conditions, and you don't know what those initial conditions are, what are the proportion of gametocyte carriers in the population? How many infected people? What are the susceptibles, etc.? How would you know what the outcome of your model is? And then, of course, there's the bit that the modelers always get really concerned about, which is parameter setting, and etc. And then, as scientists, we focus on our interpretation of the model, and we want to go back and improve the model. Yeah? But if we want to engage with decision makers, they have a different focus. Yeah? They want to re-engage with, are we asking the right question? Is this actually what we're producing on the modeling side? Is it going to answer a question that they really care about? And that is another big challenge. I've been doing some work with Adrian Tompkins, who's a great mathematical modeler, and we went back to look at the Caricho analysis again to say, well, of these three sources of uncertainty, the boundary conditions, the initial conditions, and the parameter setting, which source of uncertainty is most important in the Caricho analysis? And surprise, surprise, it was the climate data, because it's here in the highlands, it's so dependent on the temperature, and temperature is poorly described. So I think, sort of focusing in on where the uncertainty is and trying to deal with that is the scientist's role. But we have to be mindful from the get-go as to the problem focus if we want to engage decision makers. So I'd like to, of course, thank NASA, but other partners and agencies that have supported this work over quite a number of years. Thank you very much.
One question while we set up the final slides.
That was an absolutely fabulous presentation. And after we struggled so much in our session, you've answered so much of it. The one concern that was raised was how do we agree? So standardization, what role that really plays, as you say, with listening to all groups and their entities, and trying to say we have a base that we can all agree on, we all understand each other, the same terminology, and then springboard off, how can I use that, as you say, to answer an individual question or a policy decision. But the push there was, how do you really get people to come to the table, share their concerns, and agree to agree on a standardized base?
So I think there are different. I mean, if you look at the global platforms, then obviously you have WHO has a set of platforms. They now have a new joint office with WMO, which is concerned specifically with environmental and climate information entering the health decision-making process. So there's structures, if you like, within those communities about where to have that conversation. At the national level, it varies in every country. One of the things we didn't have come up at all in this meeting, which I think deserves to have at least a mention. That didn't have a mention, as far as I know, was the Global Health Security Agenda. And in a lot of countries now, the Global Health Security Agenda has motivated this cross-sectoral activity at the government level, where they have to now come and talk to each other. And I think that actually will drive a lot of the national, I don't know about in the US, but actually in the areas of the world that I work in, that will drive a lot of the national conversation because of it being a national priority. So it's the political prioritization.
Okay, well, we had intended to report out quickly on the breakouts, but in light of the time, what we're going to do is we have some notes. We have the rapporteurs take notes in the breakouts, and so there's going to be a mechanism that we're working on to continue this dialogue in the coming weeks. And so we're gonna hold off on reporting on the breakouts, but we are going to continue the conversation, and Dorian's going to tell us how we're doing that. Thank you.
One. So one of the things we find is after these meetings, we kind of walk away energized and excited, and then it just kind of falls. So we want to try a few things. If you go to, and I have the website down there, or what I find is easy is just go to Google and put in GPM Disease Initiative, and bing, you're there. Disease Initiative is one-stop shopping, and it's what we want to, I've already started it, we've gotten some conversation going, we want to keep working with it. The base camp is something that if you go in and take a look at the base camp, you'll see that there's a lot of different opportunities. What I'm hoping with the base camp is that will be a place where, as there are new citizen science opportunities, potentially the job opportunity that came along today while we're talking, new videos that are out, new research that's being done, new findings, things that you find of interest, you will post them in the base camp. And you have something you can push in the base camp, and you'll see when you look at it, it's very user-friendly. If you want everyone to be notified or no one, but when they go and look at the base camp, they'll see it. So you can kind of choose the urgency of it. So that's one way to have a really collaborative, ongoing conversation with a lot of sharing in. Another thing is there's a mailing list, and that's also on the initiative if you'd like to join that. Mike had mentioned this back in September that this would be a good idea, and I think it is a good idea, and that is a monthly newsletter. So it's something that I would take charge of collating, but I would ask all of you in this community, and there's others who are in the remote community and who've already joined the mailing list as well, to send in what are you doing, what's important, what are some things that are happening. I know Ben Zychek is I believe, leading the GeoHealth part of AGU this year, and he sent me in something to put up on the base camp. But that would also be something that I'd put out in the monthly newsletter. I was thinking perhaps using these panels that we had as kind of the parts of the monthly newsletter. The newsletter won't be a bunch of words, it will mostly be hyperlinks. Then please contribute to both of those in the ways that I just said. And then finally, Amita and I have been working on finding ways to help people who either have some experience or no experience, or in this case, this is going to be a more advanced level, helping them to see, here are these different NASA data sets, here's how you can get in and play with them. So on June 25th, we'll have an advanced level. Please do not let that scare you. If you want to take the advanced level webinar, it will probably be an hour and a half. You do not have to have advanced level ability. You can jump on, join in. We'll be talking about the different parameters, environmental data sets that are important, how to access these free data sets, ways in which you might use them. And it will be recorded so that you can go back and also repeat it at your own leisure. There's a beginner's webinar, that's right, and that is up in the Disease Initiative, that is archived. And with that, I need to get to Jacob to post it, and he's great about posting these things right away. I also made a cheat sheet so that you can look, and there's hyperlinks that you can follow along that will be useful to you to aid with that beginner level. So I hope this was useful, and I hope this also is the beginning of a conversation and collaboration. I had written a few notes as we were talking, and one was that all of us seem to feel that collaboration among different professionals, different specialties, is vital for bringing this together. And I know I certainly found that when I got started, and I heard other people talking about this as well. You need to get into the mindset of your end users to get a feel for how can we make this relevant and meaningful. Case studies are really important. I was very fortunate to get case studies from 5 of the different people who presented here today. Those are also up on our GPM Disease Initiative. Please feel free to use those. And if you have a case study that you'd like to share with us, because it can be a public health case study as well. In this case, these were case studies that were by the new and emerging science or the research scientists. But we would also like to have public health case studies as well. Because when we have these things to look at as holding up as models, and then we can walk away and say, okay, well, that's a neat idea. Perhaps I can try that and massage it and do it in a different way. That always is a huge help. The other thing I took away was the complexity of the variables that we're dealing with when we're talking about something as broad as vector-borne and water-related disease. So we're dealing with a really complicated, wicked problem that is super important. As I know Bernadette mentioned, please come to the Outbreak exhibit. Both Helena and I, as a result of being involved with this effort, we both put our hands up, and we're now volunteer docents there because it just sounded like way too much fun, and how could you not? And they said, maybe I can bring some live mosquito larvae sometime. So that gives me just more of an incentive to raise them. So anything else for the good of the cause? Yes, ma'am.
Well, thank you all for coming out to the Wilson Center to hear about waterborne and vector-borne disease. And now we are moving to the reception, which is at the Hay Adams. I would encourage you to do what I did, which is just put it in my cell phone. There are 3 ways to get there. Contingency of us, including Dorian and myself, are walking over in exactly 3 minutes and 4 seconds. It's a 17-minute walk. I don't think it's raining. I hope it's not raining. If you don't want to get wet, there's a Metro, straight shot, blue line, and you can also hail a cab, but I didn't even take that screenshot. I just took the Metro one twice because a cab will actually take you longer in DC traffic than hopping on the Metro would, and potentially walking as well. So thanks again, and see you in 20 minutes at the Hay Adams.